Keely Chambers and I'm part of the Kettering Community Midwives team. And this short video is all about the third stage of labour. Yeah, the third stage of labour. So you've laboured through the first stage, you've birthed your baby, the second stage. Now you've got your baby in your arms, hopefully, and you're having a nice skin to skin. And this is where the third stage starts. So the third stage is from when the baby is born until the delivery of the placenta. So the placenta is this complex, remarkable organ and weighs probably about 500 grams, about a pound, but varies from mother to mother. And it is such an important organ, and it doesn't get the attention that really it deserves, because once we've got a baby in our arms, we don't care about anything else. But this placenta has been in charge of ensuring that your baby has been well oxygenated all the way through your pregnancy, and that all the waste carbon dioxide has been dealt with. It's in charge of all the metabolic transfer, so ensuring your baby's got enough glucose, food to keep the baby growing perfectly. So it's involved in transferring glucose, amino acids, fatty acids, all the electrolytes, vitamins and water that your babies need. So it's so clever. On top of that, it sorts out all the hormonal, so it's got this endocrine function, so it sorts out all the hormones that is necessary to keep your pregnancy healthy. Also it has like an immunological sort of function, so it can pass some of your antibodies over to baby to give your baby that first little bit of protection when it's born. Drugs do transfer over as well, so you need to discuss that with your midwife when you're working out your birth plan or requesting any analgesia, or discuss it with your doctor, GP, if they're prescribing any drugs when you're pregnant. And this is why we say, avoid all drugs in pregnancy. The occasional bit of paracetamol is okay, but otherwise make sure it's prescribed by your doctor and you have discussed it with them. So this remarkable organ, so many functions it has, and now it's come to the end of its use, so we need to expel it out from the body. So how does that happen? So once your baby is born, the uterus then starts to shrink, and it's this shrinking that reduces the surface area over the placenta, and the placenta will shear away. So what happens then as the placenta shears away, there's this sort of open vessels, and these vessels then can bleed, obviously, because they're open, they've been, this thing is shorn away. So, but the body is so amazing. Inside your uterus is lots of sort of crisscrossing muscle bundles, these fibres, that what happens is your uterus contracts and seals off all the little vessels, stopping you from bleeding away. So there are options on how you can expel this placenta. So the options are that you have what we call an active third stage. So the active third stage consists of, once baby is born, giving you an injection, usually symptometrin, unless you have any problems such as blood pressure, asthma. You need to tell your midwife if you have those issues, or if you're also if you're very young as well, under 16. Your midwife will look through and hopefully notice all these things, but do tell them to remind them. If you have those things, that's okay. We have another drug, syntocinon, or oxytocin, that we can give you instead, and they work in a very similar way. They're working to contract that uterus to help the placenta shear away. And then if you've had drugs, because we've interfered with nature, what we usually do is just place a hand onto your lower part of your tummy to hold your tummy there, and then we'll use contraction on the cord, so we'll pull the placenta out. Now, when the placenta is born, usually as the placenta shears away, there is usually a gush of blood, and that is quite normal. And your Mother Nature is so clever. Whilst you're pregnant, your blood volume increases up to 50%. So you've got all this extra blood. So, it's quite common to lose quite a bit of blood, and blood is a bit like milk, a little bit looks a lot. And the midwife will be monitoring that to make sure that it is not too much. And if it is too much, then there is things that we can do, those drugs that we can offer to help prevent that from, becoming sort of life-threatening. The other option you have is physiological. So if you want a physiological third stage, that means that we don't do anything. So there's no pulling on the cord, there's no giving any drugs. So if you have grown your baby, made your baby, grown your baby, birthed your baby without any problems, then chances are that you will deliver your placenta without any problems. So if you would prefer to go down that route and just let nature take its course, then you can do that, and you just need to tell your midwife too. So the difference between the two is that one has a drug, one doesn't. One, you feel some contractions, well, both of them you'll feel contractions, but with the physiological, when you start to feel the contractions and a bit of heaviness, maybe down into the vagina, then the midwife might urge you to bear down and you push the placenta out, or usually it just pops out. And the other difference is that with a physiological third stage, there is no pulling on the cord at all, and obviously no drugs either. With the injection, we would expect that all to be done with, finished within about half an hour. So usually it's about 10 minutes. Yeah, but we would expect that to be half an hour. And if it wasn't half an hour, then we would probably get a doctor in just to review things if it doesn't look like it's come away. The other way with the physiological, we allow you an hour. So the research shows that it's usually about 3 to 4 hours you would physiologically release your placenta. But on the whole, I would say it's probably about 15 to 20 minutes. So within the guidelines of most hospitals, it says after an hour, then we need to start finding out why that hasn't been released. And it might be then that you might be offered drugs. The midwife might get you to go to the toilet, because like a full bladder can prevent the release of the placenta. We might get the doctor in to see, whether they can help the placenta out in any other sort of way. And that could be anything to more drugs via a drip, or if your placenta is completely stubborn, then it might mean that you might need to go into theatre to just have it sort of encouraged to be removed manually. So, to recap, the placenta, my cuddly placenta, amazing organ. It's fed your baby, it's oxygenated your baby, it's taken all the waste away, it's kept your pregnancy going with all the hormones. It sorted out, made sure that your baby has enough glucose so it can grow. So amazing, amazing. So it's done all this via the cord, and the cord usually consists of one big vein and 2 arteries. Okay, and when the baby is born, this continues to feed the baby. Now, there's usually up to 40% of baby's blood in this cord. So we don't cut and clamp straight away unless there's a reason to do so. And we allow the blood to gently pulsate, continuing to give your baby oxygen while it's getting used to now using its lungs, because it's never needed its lungs before, but now it does. So now it does. So this nature allows for the baby to continue to be oxygenated for a few more minutes and giving the baby a bit of a chance just to get used to inflating its lungs. Okay, once the cord is finished, you'll notice that instead of being a deep bluey red colour, it then goes clear, because like all that blood has gone to baby, full of beautiful stem cells and lots of lovelies in there. So baby needs that. And even with a section, a cesarean section, the doctor, as long as baby is absolutely fine, will allow that blood to transfer that to the baby. So amazing, absolutely amazing. You can see I am an absolute fan of the placenta. So you have two choices, remember. So have a little think about it, have a little read about it. You can either have active, and that is the one with the injection, or you can have no injection, and that is a physiological one. Benefits of the active one is it's slightly quicker, but not always the case. There is some research to suggest that it reduces the risk of hemorrhage, especially in those that are higher risk of hemorrhage. So maybe you've had 5 or 6 pregnancies or even more. Maybe your health isn't so good. Maybe you're diabetic. Maybe you've had an extremely long labour. Maybe you've been induced, or maybe you've had a section. So with a section, they most always give the drug, because obviously they're inside your uterus, and that's going to affect how the uterus performs. And so that will be an active third stage. So I hope you found that helpful. Please do ask your midwife if you have any other questions about placentas, and if your placenta belongs to you, we of course will dispose of it because it is as clinical waste. But if you want to take it home, we can organise that for you. Some people might want to have it dried out for its hormonal benefits, to help reduce postnatal depression. You can go online and find somebody near you that does placental encapsulation. Some people like to bury it in their garden with a tree on. Some people like to eat it, so ingest it, and there's certain benefits thought to be with that as well. And again, go online and find someone that will help you do that, and as long as you tell us, then we can ensure that you get your placenta to take home with you. Okay, so any questions, do ask your midwife, and that's the end of this video. Have a beautiful birth.